food which is put onto gods. In Hinduism, you find the Hindus, Hinduism is separate. The Hindus, what they do, they go to the temple and they give the food to God. Allah says in the Quran in Surah Anam chapter 6 verse number 14, Allah feedeth everyone but does not require to be fed. How can we human beings give food to God?
Ladies and gentlemen, good evening and welcome to Doctor in the House, the #1 show that provides you with the news and views of all things medical. So I hope it's not too late to say Happy New Year, but it's my first show for 2019. On behalf of all of us, we missed you too, and it's a delight to be back on this show. Thank you for all of your calls and messages, and just a reminder that we're live on Mondays, and there is a rerun of this show on Saturday at 1 p.m. So Monday nights we are live, but a rerun on Saturday afternoon. So tell all your friends and family. So I know a lot of students will be preparing on their last lap for examinations, but spend some time. It'll certainly be worth the wait. And as usual, we start with some of the news that dominated headlines over the past week, some with a medical flavor. There's really been a bloody start once more to 2019. This scourge of crime continues, unchecked, with nearly 50 murders so far for the year. Many videos were shared on social media with a fracas in schools and smoking as well. 6 schoolgirls have been suspended from one of the high schools in North Trinidad. It's a reminder from the Minister of Education that smoking of any substance is prohibited on a school compound. There were some reports as well that a new drug might be infiltrating schools, well, new to the local scene, called Molly. And many of the school children, apart from drinking and smoking, might actually find that they're using these drugs. The world media has been very much interested in crisis-hit Venezuela, and the United States was saying that they will be sending aid, medical, as well as supplies of varying types to that country, following a request from the opposition leader, Juan Guaido, who actually has declared himself the interim president. Venezuela's President Nicolas Maduro has accused him of mounting a coup, and he retains some major international allies. Now, this is worrying for us, especially from things like a health perspective, as it has been estimated that more than 3 million Venezuelans have actually left that country so over the past few years, and many of them are finding themselves into Trinidad and Tobago, some of them with infectious illnesses, inclusive of malaria. Maduro has so far dismissed the United States' offers of aid as a pretext for military intervention. But we know, and I've mentioned this already on the show, that what has happened there and the way that he has run that country is nothing short of a disgrace and a humanitarian disaster. There are no vaccines or life-saving medications for persons at all ages there, and so many infectious illnesses, so many potentially preventable life-threatening problems have been occurring to the Venezuelan public. And that used to be one of the wealthiest countries in the world. Perhaps it still is one of the wealthiest oil-rich places in the Western Hemisphere. But so as a result of this political struggle, we have seen this humanitarian crisis. And certainly our thoughts and prayers are with the Venezuelan people there, and many of them have actually come to Trinidad and Tobago as refugees. So this month we'll be moving into Carnival, and just some health tips. I usually mention this at the start of the year. It's not from Dr. Mashup, but nonetheless, everyone, especially for children, should stay away from speaker boxes, music trucks, and very loud steel bands or any other source of loud sounds. The value of air protection, including earplugs or air muffs, cannot be underemphasized, and it should be worn if any child or person is likely to be exposed to loud sounds for long periods of time. Sexually transmitted infections and unwanted pregnancies usually spike during the carnival season, so it's a reminder about safe sex practices, not just during this month, but indeed the year round. Children and women should stay in groups. We mentioned about this hydra-headed monster of crime, and the murder rate has already spiraled out of control. No drinking and driving. Caution at beaches and at hikes if you're not too much into the carnival scene. So I know a lot of churches, a lot of religious institutions will have camps, and those may be safer places to spend your time. The importance of heightened vigilance regarding food preparation and storage is also something to remember during the carnival. And if you're going outside, avoid dehydration and use sunscreen during these months. I know that our old friend, the renowned podiatrist from San Fernando, Ann Limmer, so is always a proponent of taking care of feet during the carnival season. Please ensure that you purchase shoes with the right fit, because corns, calluses, and blisters may occur. Inspect your feet regularly and never be barefoot, because these corns, calluses, any red flags like sores or infections, particularly for persons with diabetes, should be treated expeditiously. February 4th is World Cancer Day, and this is used to raise awareness about a dreaded disease. Cancer is still a leading cause of death worldwide, and certainly a lot more work is required to make it a global health priority. We Can, I Can has been the theme of World Cancer Day, and that's been exploring how we can all do a part to reduce the global burden for cancer. It has been estimated that perhaps 26,000 deaths occur per day as a result of cancer. And there was recent research showing in younger persons the separate global epidemic of obesity is also associated with increased chance for cancer. And there are 6 types of cancer that are associated with increased body weight, especially in younger persons, and we're seeing that more. And this includes multiple myeloma that affects the bone marrow, colorectal, the body of the womb, gallbladder, kidneys, and pancreatic cancer. So those organs seem to be surging, particularly in younger persons, and there is a definite association with increased body weight. So this global epidemic of obesity. So that's why the role of healthy lifestyles, and that's the theme usually for our open forum on Doctor in the House, healthy lifestyles, that you're thinking about diet, exercise, weight loss, stopping smoking, limiting alcohol, and making sure that you screen for different types of cancer. For example, women going for regular pap smears to look for cancer of the cervix. Women more than 40 years old, you may want to consider mammograms or ultrasounds. We often speak about the role for prostate cancer screening in men, so over the age of 50. And those are certain aspects of care to chat with your physician about. The month of February also marks Rheumatoid Arthritis Day, and we know that's one of those particularly insidious, unpleasant forms of arthritis marked by pain to the joints, stiffness, morning stiffness, and of course it may affect, apart from the joints, it may affect virtually every organ in the body, in which we normally would make antibodies to fight off infections. But in this case, with rheumatoid arthritis, and that can affect persons at any age, you're making antibodies and it's attacking joints and different organs. And Rheumatoid Arthritis Day is also to heighten the increased awareness and a need for treatment and perhaps a cure. And that's held on February 2nd annually. The dry season also marks a spike in cases during the flu season. So we've been hearing a lot about that since the start of 2019, and the value of vaccinating. Since last year, I know that's one of the themes for healthy lifestyles, and prevention. The watchword is prevention. And from the start of winter in North America and Europe, right through into the carnival season and perhaps into May, there's usually increased flu activity. The influenza virus tends to peak. There's more hospitalizations and, tragically, more flu-associated deaths in children. And, well, in fact, in all persons, children and adults. It's important to avoid close contact with people who are sick. So if you're sneezing, the runny nose, stay away. Just breathing out can spread these aerosols of the flu virus. And just some tips, though, to stay home from work and school and avoid running errands when you're sick. Cover your mouth and nose with a tissue if you're sneezing, or if you're coughing or sneezing to your sleeve. Wash your hands often, or there's a plethora of hand sanitizers available which may help to protect you from germs. Avoid touching your eyes, nose, or mouth after you touch something like perhaps a doorknob or money that might be potentially contaminated with germs, because viruses and bacteria can live on surfaces for many hours. You want to clean frequently touched surfaces like desks, especially at home, work, or school, especially when someone is sick. And in general, get plenty of sleep, be physically active, manage your stress levels, lots of fluids and nutritious foods to boost immunity and stay healthy. So that's a little plug, perhaps, towards the fruits, vegetables, the peas and beans, low-fat and low-salt foods, and avoiding sugar. And don't forget exercise. I mentioned that as well, about 30 to 60 minutes of exercise, some sort of physical activity for most days in the week should also increase immunity. Pregnant women who were sick with the flu virus found that when they were admitted to the intensive care unit, they were more likely to have premature or low-weight babies than expectant mothers who had milder symptoms, or those who didn't catch the flu at all. And I know that we had some deaths, unfortunately, in pregnant women due to the influenza virus. And this year it seems to be a resurgence of the so-called H1N1 virus. Just a reminder that certain high-risk groups should afford themselves to the flu vaccine, which is readily available nationwide, now I hope. Persons with chronic medical conditions such as diabetes, heart disease, kidney disease, those medical problems which lower immunity, healthcare professionals, pregnant patients, and those at extremes of age, persons perhaps 6 months to 5 years old, and those over 65. The vaccine usually would not be recommended for persons under 6 months of age. So it's a reminder. Then that perhaps carers of those persons should be affording themselves to the opportunity to vaccinate against influenza. You don't want to find that you're running into some of the life-threatening complications of influenza infections, such as a pneumonia and respiratory failure, or lung failure and death. What we found in 2009, when there was the global epidemic of H1N1, the 2009 H1N1 epidemic that started in Mexico and subsequently affected us and the rest of the world, was that increased body weight, so once more we're talking about obesity, seemed to also be a risk factor for persons running into life-threatening complications of influenza. So if you're overweight, you want to be careful and perhaps being vaccinated. So that's another high-risk group that was identified back in 2009. Some of the neighboring islands, such as Barbados and Jamaica, have also noticed a surge in dengue, and that's also something that we must be vigilant about, especially when we're talking about getting rid or eliminating potential breeding sites for the Aedes aegypti. As I always say, these mosquitoes love our nasty country, but this is something where we need to take personal responsibility in ensuring that our surroundings are kept clean to prevent this surge in dengue. Persons who are afraid of vaccines, that's always something that we hear about, and in social media we've seen a lot of fake news actually being shared as to potential side effects of vaccines. No vaccine is totally safe, and we know that very rarely that these have been associated with some neurological or nerve problems. Now, of course, the infection itself, like let's say the flu virus, can cause some of these potentially paralyzing illnesses. There's one that's often mentioned in the popular press called Guillain-Barré syndrome or GB syndrome. Now that's uncommon, it's very rare, and it can be associated too with the infection rather than the vaccine. So in places like the United States and Europe, where many vaccines are no longer mandatory, they're actually seeing a surge or a spike in infectious illnesses. So recently, there was a measles outbreak. Now, that's something that we don't really see anymore in Trinidad because the measles, mumps, and rubella shot is mandatory prior to entry to primary school. So the fantastic vaccination program here has actually ensured that our children and young persons are protected. But it's not so in places like the United States, so-called first world countries that actually believe that these vaccines are associated with life-threatening side effects. So mothers and fathers have been saying that they don't want to vaccinate children against measles, and that has led to this outbreak of this childhood infection and perhaps things like polio. That we will soon be seeing in places like Venezuela, and they're actually seeing it in some areas like Syria, where we know that those are war-torn countries and places actually struggling in terms of a humanitarian crisis, that we're going to see infectious illnesses making a surge, and remembering that we are so close to many of these places like Venezuela. We know the world now is a global village, and many of these refugees are seeking asylum in parts of the world. So it's important to vaccinate and be vigilant about some of these infectious illnesses that we assumed had been eradicated in the Western Hemisphere. Some interesting news that a woman is actually suing the North Central Regional Health Authority because allegedly wrong medications were administered, and she subsequently got a stroke. Rampant overcrowding and poor conditions at the Port of Spain General Hospital have been highlighted at nurses there since the closure of one of the blocks, and hopefully this will be rectified very soon for not just the healthcare workers, but indeed the patients in these regions. So if you're finding that these nights and early mornings are quite chilly, now I agree with you, they have been quite chilly in Trinidad, but this frigid and deadly weather has actually slipped into the continental Midwestern states of the US. And so apparently there is a phenomenon there called the polar vortex, which is usually present, but those cold winds and record low temperatures have been noted in parts of the Northern Hemisphere. And that has led to widespread school and business closures and major travel disruptions. And many of the homeless shelters actually overburdened, so as a result of these severe wintry conditions in North America and Europe. And several people have actually died thus far from hypothermia, which is associated with prolonged exposure to cold and a very low body temperature and organ failure. So I actually saw that as almost like Mother Nature's revolting, because in Queensland in Australia there's widespread flooding. So this time is actually summer in Southern Hemisphere, and widespread flooding with crocodiles in the streets. So it's something out of a movie in Queensland, Australia, and that's occurring actually this week down under. The New England Journal of Medicine is one of the reputable medical journals that we will often refer to, and there was a fascinating study there that 900 persons from the United Kingdom who smoke conventional cigarettes were found to be more likely to stop. They were more likely to quit when they used these newfangled type of e-cigarettes instead of nicotine replacement therapy as a quit aid. Now, it doesn't mean that the e-cigarettes are safe. So in fact, a lot of studies are showing to the contrary, that many of the compounds found in these or these vaping type machines may not be totally safe versus the conventional cigarettes, but perhaps they were more effective than the nicotine gum or nicotine patches or inhalers when trying to quit. So that was a study that was published just last week in 900 persons in the United Kingdom. The British Medical Journal also published research from Australia showing that despite long-held beliefs about breakfast being the most important meal of the day and widespread recommendations, that perhaps breakfast doesn't play such an important role in weight loss after all. So they were saying, after they looked at many trials, that there was no evidence that eating breakfast reduced the daily intake of calories or weight gain. And it was no worse in those who skipped that meal. Now, I would still think, though, that it seems prudent that you don't want to be overeating too late, especially at night. And at all meals, you want to be ensuring that balance is right in terms of the carbohydrates, fats, proteins, vitamins, and minerals. But in terms of research, that perhaps skipping breakfast was not necessarily associated with weight gain versus those persons who actually had breakfast. So if you're thinking about a healthy breakfast, of course, you're thinking about perhaps your oats, your fruits, vegetables, and something to ensure that it sets the tone for the day. And staying towards food, a survey of what working persons in the United States ate for the week found that 1 in 4 persons who ate at work, so this is actually a plug to pack your doggy bag and ensure that you're going to work with something healthy, once more like the fruits and vegetables or something from home. They found that 1 in 4 persons who ate food at work, those meals were generally high in empty calories, salt, fat, and sugar, because many of these treats include pizza, soft drinks, cookies, brownies, cakes, pies, and candy. And when they were added up, it exceeded perhaps 1,300 calories per week. So 1 in 4 persons actually having unhealthy food at work, and that might include food that you're having at a meeting perhaps at work. So those are lunches which are ordered and brought in to the institution. And I think that it would be worthwhile that we extended that the school feeding programs should be regularly evaluated by dietitians, because these are contracts that might be awarded to different persons, and ensuring that the food provided for the nation's children will be low in sugar, salt, saturated fat, and starches. So I always like to mention a bit of sport and cricket. Congratulations to Jason Holder's band of West Indian cricketers who inflicted a 1980s style thrashing on the hapless Britishers, those hapless Englishmen, in a rollicking test series so far. So they are leading 2-0, and fond memories actually going to the Queen's Park Oval with my father, and that was actually the first game that I saw was actually West Indies and England when Gower was the captain of England in the 1980s, and being part of that so-called blackwash back in the 1980s and seeing that good old 1980s thrashing was almost like you had stepped into a time machine. And in closing, it's part of the Diabetes Corner, and once more extending into the healthy lifestyles theme. Kudos to the Diabetes Association of Trinidad and Tobago as they upgraded the center in Shogunas, and that has included free sugar testing and information for persons not just who may be living with diabetes, but if you're just interested in knowing more about this scourge. It has been estimated that there are 420 million people living with diabetes in the world, and the frightening stats are that 1 in 2 people do not even know that they have this illness. And of course, it's mirrored once more by the pandemic of obesity, which I mentioned earlier. Last week, 2 powerful lawmakers in the United States sent letters to 3 leading insulin manufacturers there, requesting information on why the cost of insulin has skyrocketed in recent years and how much the companies will be profiting from the life-saving diabetes treatment. Now, that's one of my pet peeves on this show, because insulin, in fact, will be about 100 years since the discovery of insulin by Frederick Banting and Charles Best, that Nobel Prize-winning research which was done in Canada. So close to 100 years, and yet the exorbitant prices continue to make especially novel forms of insulin difficult to purchase, not just in Trinidad and Tobago, but worldwide. So the lawmakers in the United States want to find out why. Why is it? And that patent was sold by the researchers for $1 from the University of Toronto in Canada. And why is it that these manufacturers seem to be increasing prices? This weekend, some fascinating research that statins, those drugs which are frequently used in persons with diabetes, but they're used to protect the heart and lower the chance for stroke. Of course, the primary indication is to lower cholesterol, and statins were useful in persons at all ages, and that included those more than 75 years old. And stress and negativity, we know that that's associated as risk factors for a host of adverse or negative health effects. But what they found is that, particularly in post-menopausal women, stress, anxiety, anger, or hostility was a powerful independent risk factor to increase the risk for type 2 diabetes. So persons who had a positive outlook, persons who were less likely to be angry and hostile, particularly in that post-menopausal female age group, they were less likely to become type 2 diabetics. So interesting research. Women who ate fried chicken every day were found to be 13% more likely to die prematurely than those persons who avoided those foods, and a similar increased chance for premature death was found in those persons who had fried fish every day. So that was some interesting research in the United States last week too. And there is a phenomenon perhaps which I don't mention enough on this show called diabetes distress. And that's a problem that many patients have. So they don't express it, or perhaps they don't know that it's actually occurring. And maybe we as healthcare professionals must recognize it more. Diabetes distress is that feeling in which you're powerless. You feel powerless in the face of diabetes. We know that it's a difficult task when you're dealing with a relatively invisible problem like type 2 diabetes. So I was reading an article online where they actually emphasize the role of the doctor or the healthcare worker and even family members in recognizing that in patients. It's time that we find ways to show persons who are diagnosed with diabetes that even small, even very tiny self-care efforts can make a difference. The perseverance, the love, the humility, the care that's often required to guide these patients through peaks and troughs in their lives can sometimes be a very arduous task. And it's important to avoid burnout and screen so many of our diabetic patients for depression. It's been thought that about 30 to 40% of all persons with diabetes may also be depressed. So that's almost like a separate global epidemic too, in which there may be issues with mood. Persons may find that they have issues sleeping, problems with appetite, trouble with memory, difficulty concentrating, the self-esteem is low, and things that you used to enjoy doing, you don't have any zeal or pleasure in performing those tasks. And indeed, some persons have suicidal thoughts. We find that with a lot of people diagnosed with type 2 diabetes, they believe it's a death sentence. They've heard about the fact that it's the leading cause of blindness among working-aged persons, a #1 cause for kidney disease and dialysis, a leading cause of non-traumatic loss of limbs. But that does not happen. That does not have to happen to you. if diabetes is well controlled. That risk has been found to be reduced astronomically, and they've demonstrated that in studies not just abroad but locally, that tight control of the sugar, the blood pressure, cholesterol, regular checkups, regular screening, ensuring that you work with your physician and healthcare provider to live successfully with this chronic disease will ensure that you do not get the complications, or if they occur, that they are treated appropriately and in time. Right, let's take a short break, and when we return, it's the open house and we'll take your calls, so don't go anywhere.
High blood pressure is as dangerous as an overpumped balloon. Measuring your blood pressure every day can save you from risk of high blood pressure. MicroLife fully automatic upper arm blood pressure monitor with stroke risk detection. MicroLife AFib screens for atrial fibrillation while taking your blood pressure. High blood pressure and atrial fibrillation are both considered controllable risk factors for stroke. If AFib is present during blood pressure measurement, the AFib icon is displayed flashing at the end of the triple measurement. Once 3 measurements are complete, the measurement data are shown on the display. MicroLife, a partner for people, for life.
Need medical assistance? Come check us out at Ultimate Medical Clinic. We offer a wide variety of medical treatments. Why live in pain and suffer with wounds and ulcers?
Ultimate Medical Clinic also provides laser therapy for pain relief and wound healing.
We also treat arthritis, knee, neck pains, diabetic neuropathy, diabetic foot sores, psoriasis, eczema, and many more health conditions. Call us today to schedule your appointment, 665-1188, or visit us at 111A John Street, Montrose, Chaguanas.
Welcome back to Doctor in the House. So it's a reminder that we're live on Monday nights and there's a rerun on Saturday afternoon at 1 p.m. It's a pleasure to have you. And as usual, after the medical news, we have a bit of the lighter side with a medical twist. So let's have a look. It's from the BBC show Hero.
The problem with my ears is getting worse. I need to see Piers.
You can't. He's gone home.
What? Pier? Another Pier? Piers? Not. Ow! Ear? You? Deaf? Old? Mackerel? Flounder? Trout? Pier's not here, you deaf old trout! How dare you! You come out now, you big girl.
Thank you, Mrs. Raven. Since George shone his torch into the darkest corners of my life, I can't face treating patients. I wouldn't know where to start.
Never stopped you before. Stop being so pathetic.
He destroyed me. At this rate, I'll end up drinking super lager with the winos in the park. They'll probably call me college because of my posh voice.
They'll probably call you tosspot because of all the rubbish you talk.
I'm sorry.
Listen, matey. There's only two things that get me up in the morning. The fact that the triplets keep their stash of high explosives under my bed. And the thought of coming in here and fighting with you. And I'm not going to let you take that away from me, all right?
I'll get a cloth.
Right, so hopefully we don't have to experience too many receptionists like that. And so I would like to say a special welcome to Mr. Sat Budram and Dr. Neela Ramdas Teelucksingh. A special hello to the Gangadine family. So I know that there is a birthday there as well. To Yvette is celebrating her birthday on February the 4th. We dig into the birthday bag that Mr. Dalchan Ramdas is celebrating his on the, well, he has celebrated his on the 1st of February. Rhonda Parry as well, the latter part of January. Vintra Mahabir is on February the 7th. Sarah and Shanta Budram had theirs in the month of January. A special hello to Dr. Shalana Duki, who's also celebrating hers this week. And my birthday is actually February the 8th. So I won't say my age, but nonetheless, a special hello to the Husseins from Princess Town, so the grandmother of Dr. Amanda Hussein, Amina Hussein. So I understand that she is a firm fan of the show. Good evening to you and to your family. Condolences to the family of Mrs. Meena Khan, who passed away this morning, and our thoughts and prayers are certainly with you and the rest of the Khan family. She was a caller on this show. She was a regular caller on Doctor in the House, and certainly we remember her, lovely woman, and indeed she is safe in heaven. Let's take a short break, and when we return, the phone lines will be open on Doctor in the House. Stay with us.
High blood pressure is as dangerous as an overpumped balloon. Measuring your blood pressure every day can save you from risk of high blood pressure. MicroLife fully automatic upper arm blood pressure monitor with stroke risk detection. MicroLife AFib screens for atrial fibrillation while taking your blood pressure. High blood pressure and atrial fibrillation are both considered controllable risk factors for stroke. If AFib is present during blood pressure measurement, the AFib icon is displayed flashing at the end of the triple measurement. Once 3 measurements are complete, the measurement data are shown on the display. MicroLife, a partner for people, for life.
Welcome back to Doctor in the House. So the phone lines are open and they should be appearing on the screen. We'd love to hear from you. So it's the open forum and the theme is healthy lifestyles. Just a reminder that when you're patched into the studio, if you could mute your television set, listen on the telephone, and because there is a bit of a feedback and a delay, so it will make things rather confusing if you try to listen on your TV set. So mute the television set, listen on your telephone. The phone lines are open. And while we await our first caller for the evening, I just wanted to return to an item that we mentioned about statins. So that's often a class of drugs that generates fear among patients. Perhaps it may be associated with muscle aches and pains. Some persons have heard about the chance for liver damage, but that's of course fabulously rare. The truth is that statins lower the chance for heart attacks, strokes, and may actually reduce the chance for death, so it reduces mortality. And many classes, many groups of persons may actually benefit from statin use. We'll talk a little bit more about that after our first caller from QREP. Good evening and welcome to Doctor in the House.
Good
Thank you for joining us, ma'am.
What I'm calling about is that under my big toe, on the sole of my left foot, there's something like a corn in it. So I bought callus caps.
Yes.
Salicylic acid. It is said to clinically proven for callus removal. But when I'm looking at the back, they said do not use if you are diabetic.
Right.
Now I normally deal with my herbalist, and he told me what to do. Take a file and file down that area. Now it does not hurt. I can press it. I can do what it doesn't hurt. But when pressing it, it feels like a button, a hard button, on my feet, on my foot.
Okay.
I'm wondering if it's okay to go ahead and use this callus caps removal.
Thank you very much for taking the time to call in, and that's an excellent question because it is so common. We mentioned about the role and the importance of foot care around the carnival time, but all persons with diabetes should be inspecting their feet daily because you want to detect problems like corns, calluses, infections, and ulcers. Now, some persons may find and they believe that it's a callus, known locally as a fish eye, if you wish, but it can actually be something called a viral wart that can form a hard spot on the lower part of the foot or the sole of the foot. And salicylic acid is useful because it gets rid of the top layer of skin. It would be important to actually chat with a physician because sometimes this filing can predispose you to infections because, but remember, you're breaking the integrity of the skin. Similarly, if you're using these corn caps or plasters which have salicylic acid impregnated on them and you lift it up, it can actually break the skin. It actually can cause an ulcer, and that can subsequently become infected and cause a chain reaction that you'd rather not have in somebody with diabetes. Ensure that your sugars are well controlled. Chat with your doctor about it. It may be a viral wart, and there are other forms of treatment that may be available. So it may not just be hard, dead skin. There may be a viral, so it may be a viral wart. They may want to think about referring you to a skin specialist or dermatologist. Ensuring too that you're never barefooted, inspecting daily a few times a day. If you have problems with your eyesight, ask a family member or friend to ensure that there is no focus of infection that may require antibiotics. But the use of the corn plaster and filing, I'd want to hesitate to advise that. So over the phone, check with your regular physician, with your diabetes doctor before attempting to treat that at home. There are many podiatrists too who may want to manage this in a controlled environment, or a chiropodist, and that is actually a specialty involved in the management of feet-related disorders. We head to Central Trinidad, to Freeport. Good evening and welcome to Doctor in the House. Hello.
Hi, good evening.
Thank you for joining us, ma'am. Welcome.
Hello.
Hello, you're on the air. Thank you for joining us.
For the past 2 years, right, what happened? Right. I keep getting mouth ulcers, and it's not going away. Once it... And a lot of abdominal pain with it.
Okay. Oh boy, I'm sorry to hear that. Have you tried medications? Have you tried any treatment so far?
Yeah, a lot of over-the-counter medication.
Okay, okay. A lot of those gels and creams.
But nothing is working.
Okay. Thank you very much for taking the time to call in. Now, one of the disclaimers on this show is that I'm not attempting to make a diagnosis, but what I can say is that mouth ulcers, while sometimes they can be very painful and annoying, they can range from infections to sometimes problems with the level of immunity. So it could represent a medical illness, especially if you're having pain in the abdomen, pain in the tummy, and it's associated with the mouth ulcers. Some persons find that when they're stressed out, that they get these sores, and these can occasionally be treated with washes or with tablets. So there may be medications available to treat it. There are viruses that have been associated with causing these ulcers, especially if something has lowered your level of immunity. Your doctor may want to consider doing blood tests too. So I think now that it's been ongoing for the past 2 years, I definitely recommend that you do certain blood tests. You'd want to chat with your physician in the health center about doing blood investigations, and perhaps even referring you to specialists in the hospital. They may be, once more, the ears, nose and throat doctors often have to contend with patients presenting with painful mouth ulcers. I didn't ask if they were painful or painless, but there are many reasons for that. There may be medications that have been associated with mouth ulcers. There may be ulcers elsewhere in your body, perhaps the genital tract, perhaps in your skin. So there may be infections, it may be issues with immunity, there may be medications that can cause these ulcers, but the most important thing is to see if there are causes. So if a definite cause can be identified. Some persons actually find that they're treated with steroids and a host of other drugs, but that once more should be done under supervision and with regular physician consultations. But some wonderful questions thus far. And let's go to Ruka. Good evening and welcome to Doctor in the House. It's a pleasure to have you on the air. Hello.
Hi, Doctor.
Welcome, sir.
Hi, Doctor. Very good program. It's always a pleasure listening to you.
Thank you very much, and it's a delight to have you on the show.
There are two things which I would like you to deal with.
Sure.
Could you advise the diabetic on the kidney patients, people who have kidney problems? I want you to give them a little advice on their diet.
Right.
What they should avoid and what they can eat. And the other issue is that I want you to educate diabetics on collecting their insulin in pharmacies, how it should be transported home, and how I want you to advise them about using a cool container in transporting this insulin to their home, because apparently the pharmacists are not doing what they're supposed to do to advise patients. Some people collect their insulin and they go to the market, they go to the groceries.
Yes.
And by the time they get home, the insulin is no good.
So true.
So you can just touch on those two important topics.
Thank you very much. And two very insightful points or observations there. So the first one involved the diabetic patient with kidney disease. Now, that's a specific group because many persons think that if you're a diabetic with normal kidney function, that the diet is the same if you're a diabetic on dialysis or a diabetic with end-stage kidney disease, and that is untrue. That is why most persons, in fact, I would say all persons with diabetes, particularly if you have a declining kidney function, you should actually sit and chat with a dietitian. So I know that there is a plethora of information online that you can access via the internet about diet. However, one must be careful, and of course you want to be vigilant about some of the information that you get from that medium. Now, low salt is perhaps one of the things that we always preach. Apart from the fact that it can affect blood pressure, it can also be associated with fluid retention. Persons may also find that they will be advised about their protein intake when they have trouble with their kidneys. A diet that is low in saturated fat, a diet that is low in sugar should be something for all diabetics. Leaching of vegetables, so that's something that we always speak about because the diabetic patient with kidney disease finds that certain salts are also monitored and they may be abnormal, particularly the potassium. The potassium is not excreted regularly in somebody or readily in somebody who has impaired kidney function. And if that level rises, it can cause life-threatening arrhythmias, life-threatening problems with the rhythm of the heart. So avoidance of some foods like bananas, coconut water, some of the green leafy vegetables, you want to reduce the intake because of the potential of increased potassium. So another salt or mineral that can become very high to the detriment of the kidney patient is phosphorus. So the phosphate level becomes very high, and that may be found in different foods too. So certain fruits and vegetables, you want to pay attention, although we're saying, so as part of that we're painting with a broad brush, that fruits and vegetables are fantastic because they're rich in vitamins, minerals, and fiber. Certain groups of patients, and that's why that caller from Aruka is very much on the ball, that patients with kidney disease should have a chat with their doctors, a chat with their dietitians about how to plan their meals. In terms of storage of insulin, that is a hormone that is produced by the pancreas. The insulin injections that we get, of course, would be manufactured in a laboratory, but these can be broken down at high temperatures. So direct exposure to sunlight affects the potency of insulin and can render it useless. So you find that you're injecting insulin and you think, hang on, but this isn't working. And the reason is that the potency has been lost, that the efficacy of insulin has been reduced because of exposure to high temperatures. So if you're getting forms of insulin with a vial, which is readily available on CDAP, or before you've used some of these insulin pens prior to use, they should be stored in a refrigerator, not frozen, so they're kept at a temperature perhaps at 4 degrees Celsius. And that transportation of the insulin, as he was emphasizing, that transportation of the insulin from the pharmacy to home should be done in an expeditious manner and with a proper cooling environment, a proper cooler. That same advice refers to certain injections that may help with your blood count that are often administered to kidney patients. There may be some special injections to administer to patients with rheumatoid arthritis and some of the autoimmune illnesses, and that advice must be given. I know that in a hospital setting that they will not give you those medications unless you present that cooler to the pharmacist. And I think that's something that perhaps the pharmacies nationwide should be adopting. That should be a dictum, that walk with your cooler prior to filling your prescription. So some useful pearls of wisdom there from our friend from Aruka. A special good evening to him. And we stay in the East. We head over to Maloney. Hello and welcome to the show.
Hello, good night.
Thank you for joining us.
Calling to find out about like a diabetic, right?
Yes.
This person have two things by his big toe on his side, right?
Right.
It's numb and it's pain in him.
Okay.
And next thing is from his legs to his muscles and just get cramp like.
Okay.
Lock.
Okay.
Very paining. Where is the cause of that? But he's a diabetic, eh?
Right. Thank you for calling in, since that is a common problem faced by many of our patients with diabetes, in that sometimes of course, you are prone to foot infections for different reasons. Perhaps so as a result of a reduced blood flow to the legs, there may be nerve damage. Many of the patients are unable to feel if they have any sticks or any trauma, and this can progress into life-threatening ulcers, infection, and even amputation. So that's why we've been saying that inspect your feet every day. If you have issues with the eyes, if you have trouble seeing, ask a family member. Get your doctor to inspect your feet, perhaps at every visit. Check the pulses, check sensation. Take off your socks and shoes in a doctor's office. Those are some of the subtle things that can actually save toes and save limbs. Now, some of those spots can actually be numb as a result of nerve damage. So those tiny nerve endings may be affected from poorly controlled blood sugars. Patients may actually get burning. Apart from the numbness, they may get a pins and needles sensation, the so-called junjuni that we talk about on the show. And those cramps can be non-specific. So there are many reasons for cramps and why those muscles in the legs may go into spasm. But it can also be a symptom of nerve involvement, sometimes blood flow involvement. Persons who find that they get a cramping sensation in their legs if they walk around and it's relieved at rest, that could sometimes indicate problems with blood flow to the arteries. Persons with circulatory issues to the veins, varicose veins, may cause cramps. Those individuals with even medications, I spoke about statins, those drugs used for cholesterol, those have been found to be associated with an increased risk for cramps, and some drugs. Now, I'm not saying to stop your statin drugs, that's not the only reason. Those individuals too, I sometimes would recommend that they check a thyroid function test. See if the thyroid is underactive, especially if you're having symptoms. That can be associated with muscle cramps. There's a lot of research worldwide about vitamin D. Sometimes when you look upon the internet, you hear about a low level of vitamin D associated in this country, because although we live in the tropics, we don't absorb as much sunlight. So a low level of vitamin D seems to be a separate epidemic in persons with type 2 diabetes, obesity, and in the West Indian type of population. And that can sometimes cause muscle weakness too. So there are many reasons. It's something to chat with the doctor about, just to ensure that those spots are not prone to infection. So regular checkups of the feet. So I mentioned about making sure that the eyes are also assessed by an ophthalmologist. So that's a doctor who has specialized in the care of the eyes. You're looking for problems like bleeding to the back of the eyes. You're looking for cataracts, for glaucoma, any changes in vision. So it's not just a matter of having your eyes tested for glasses or for contact lenses. You want to ensure that the health of the eyes is maintained, and that should be done at least annually by an ophthalmologist. Doing regular blood tests to check the kidney function, the hemoglobin A1C, the cholesterol, looking for whether there's any spillage of protein in the urine. Those are things to be monitoring in a person with diabetes. Right, so we head to the south, and we have a caller from Princestown. Hello, welcome to Doctor in the House. Hello, welcome, sir.
Yes, good night, Dr. Teelucksingh.
Thank you for joining us.
Yes, ma'am. Very informative program.
Thank you, sir.
Hello?
Hello, yes, we're hearing you, but listen on your telephone.
Yeah.
Right.
Yeah, yes, Dr. Teelucksingh.
Yes, sir.
Hi. My cholesterol over the years was between 180, 190, and just after a year before it was 210, and when I went to the next test this year, it was 240. And because one has statin drugs now.
Right.
I do exercise every week. I exercise like 4 days a week.
Great.
I've already set up body fat and things like that.
Excellent.
And I was trying to eat a little healthy.
Right.
And I was concerned about the level of the 240 the last week, and about 2 months ago.
Right.
And they put one a statin drug. But I feel a little, sometimes I feel my body hurts and that.
Right.
With an aspirin now.
Okay.
I think with aspirin as a control. Is it very concerning? Is it very concerning with that cholesterol? What are the instructions on the statin thing? It has a lot of side effects, ton of side effects. But I want to know the concerns about the cholesterol reaching that level. Is it so alarming to be so concerned about?
Thank you very much for taking the time to call in, since that is a phenomenon which we find in many patients. Someone like you who may be young, fit and healthy, so you're doing everything right in terms of the diet and exercise. So you're making sure that you're having all your oats and soluble fiber. You've been exercising 30 to 60 minutes for most days in the week. But with certain individuals, we find that genetics can predispose you. So the liver makes a certain amount of cholesterol. Now that's a soft, waxy substance that forms a vital part of our bodies. So it's used for cell membranes, for hormones, to make things like vitamin D and so forth. So we all need a certain amount of cholesterol in the body. But what we know is that sometimes, because of genetic because of your genetic predisposition, the body may be making too much or may not be clearing the cholesterol effectively. And that can be a risk factor for certain things like heart disease and strokes. It is thought that things like a high level of cholesterol, diabetes, high blood pressure, and smoking, and many of these traditional risk factors increase inflammation in the arteries. And that sets a sequence of events at which you may get actually the so-called plaque in the arteries. So what we have found is that certain high-risk groups, persons with diabetes, particularly if they're aged 40 to 75 years, you may want to consider using one of these statin drugs. If you've had a heart attack or stroke, or if you have blockages to the arteries, perhaps in your legs, you are at a risk of having complications and death, and they must be on one of these statin drugs to lower this risk. Those persons who have a low density lipoprotein, so when you do your fasting lipid profile, you sometimes will see a so-called good type or HDL and a bad type or LDL, so high density lipoprotein and low density lipoproteins. And those persons who have a LDL or the bad type which exceeds 190, you may want to consider using a statin, 190. Persons whom are deemed to be at a risk for having a heart attack or stroke, so perhaps they have a bad family history, maybe they're getting older, those persons, so there's a mathematical equation that a doctor can plug into his phone or on the computer and say, okay, you are high risk, so maybe we may want to consider using a statin. And that study that was done just last week showed that those advantages extend to persons even over the age of 75. So I'm thinking that your doctor has looked at your total level, perhaps looked at the level of low density lipoprotein, and was worried enough to consider starting a statin. Whether or not you may require the statin long term, so it's a matter for you and your physician to chat about. Many of the side effects that you see on the package insert for drugs, those are merely listed side effects. They're fabulously rare. Most persons will not get these adverse effects. So it's important to remember that the advantages accrued from using not just statins, but many of these drugs, if not all these drugs, the advantages are certainly greater than the chance of side effects. But if you find that you're running into side effects, just a reminder, I would say, check a thyroid function. Talk to your doctor whether or not that you may want to look for secondary causes. So if you drink alcohol, you may want to consider reducing the alcohol intake. So I know you're slim and trim, so that's a step in the right direction, and your lifestyle seems something that you're adhering to, a very healthy one. So I want to congratulate you that at least you're thinking in a proactive manner. You're thinking towards preventing some of these lifestyle illnesses. Maybe after a few months when you recheck your bloods, your doctor may want to consider what is called de-prescribing. So may want to think about perhaps reducing the dose, so discussing if it's necessary to continue. Because as I said, many persons who have genetic predispositions to a high level of the cholesterol may find that they require these drugs long term. Right, let's take a final caller from Central, from Charlieville. Good evening and welcome to Doctor in the House.
Hi, good evening.
Thank you for joining us, ma'am. You're on the air.
You're welcome. I'm calling on behalf of my dad. He has an enlarged prostate.
Okay.
And at the moment, he's taking something called Flomax.
Right.
But, can you enlighten us more give us some more information about this enlarged prostate?
Certainly.
I'll listen off the air.
Thank you for taking the time to call in for Dad. And the prostate is a walnut-sized gland, so normally it's about the size of a walnut, and it's close by to the bladder. Now, the prostate and the role and function of the prostate is usually to produce the fluid that makes up semen. So it nourishes the sperm, and it makes the seminal fluid. Now, the problem with the prostate is that it can sometimes become cancerous, so that's one of the things that we recommend men screen for. Just as women are often told that they should be screening for breast cancer or doing regular pap smears for cancer of the neck of the womb or cervix. So men, particularly if they have a family history, the Afro-Trinidadian male, and if you're over 50, you want to consider screening for diseases of the prostate. However, most persons will not have a cancerous prostate. What they have is enlargement of the prostate, benign enlargement of the cells of the prostate and the tissues of the prostate. However, that can sometimes affect the flow of urine. Some men find that they urinate far too often. They wake up at night on multiple occasions. Some may find that they have trouble to urinate, that they're forcing, and they have that urge, but they're actually struggling. So there are drugs that are available to actually relax or affect the smooth muscle of the prostate. Some drugs are actually geared, well, they may be different, but medications if your doctor has deemed that you have prostate cancer. But drugs, some of which are available on the CDAP, and you mentioned one of the readily available over-the-counter remedies, those are frequently employed for enlargement of the prostate in persons who are having trouble to urinate. It's under the purview of the urologist, so that's the specialty in clinical practice involved with studies, the study of problems affecting the prostate and issues like kidney stones. So you may want to check with your urologist. I still send men for an annual check on the PSA, which is a blood test to actually look for prostate cancer. Can sometimes be high with an inflamed or infected prostate. It can occasionally be elevated with benign enlargement of the prostate. Sounds like Dad, so if he's having issues with urine, drugs like Flomax or some of the available ones on CDAP like terazocin, those agents actually affect the muscle in the prostate and actually help urine flow. There was some studies showing that that family of drugs might actually be beneficial for even persons with kidney stones to actually improve or increase the amount of urine that is produced. So it was an excellent question. It still does not mean that he should not be screened. We speak about the value of the rectal examination. There are some dark clouds now in medicine as to the utility of this, whether or not we need to be doing a finger test in every man. So even the blood test that I mentioned, the PSA, there's still some controversy as to whether or not it would be beneficial in all males as a screening test. Just as we could sit down and talk about whether or not all women should have mammograms, whether or not there should be statins in drinking water. So that's something that actually generates a lot of debate and controversy when we attend medical meetings abroad. Right, so I think that we had a host of fantastic questions, but I'd like to close this evening with an inspirational video which is entitled Be the Change. Mahatma Gandhi was assassinated on January the 30th, 1948. So I just thought that it would be appropriate, as one of his well-known quotes was, "Be the change that you wish to see in the world." And this video is entitled Be the Change. Let's have a look.
Now, some of the things that's going to happen when you look out and see what can I contribute to, what can I give, I guarantee you, ladies and gentlemen, you're going to have a voice that's saying, it's just no use. It's out of control now. There will be a voice telling you that you'll be wasting your time and wasting your energy and wasting your effort. I say don't listen to it. Listen to that still small voice that says, I can do something, and I ought to do it. We ought to do it. Disraeli said this: nothing can resist the will of a people that will stake even their existence on the extent of their purpose for good. I strongly believe that all of us have some work to do, that each one of us showed up to do something, that each one of us showed up to contribute something to life, and that if we don't do it, it will not be done. Be it that you want to help and contribute to youth or do something for the homeless, whatever you want to do, if you get up in the morning out of a sense of ought and decide that I am an opening for the universe, that life can work through and use me as a channel and as an instrument for change.
How will you serve the world? What do they need that your talent can provide? That's all you have to figure out. I can tell you from experience, the effect you have on others is the most valuable currency there is. You are ready and able to do beautiful things in this world. And after you walk through those doors today, you will only ever have two choices, love or fear. Choose love, and don't ever let fear turn you against your playful heart.
Begin to see yourself as an opening for the universe, to move through, to work through, to make a difference in life. See yourself being used by life to improve the quality of life, to expand and to grow.
Be the change that you want to see. Thanks to our devoted callers and viewers, efficient crew, and delightful studio audience. Good night, God bless, and enjoy the week ahead.
High blood pressure is as dangerous as an overpumped balloon.